Oh, hi! Have you used these before to lubricate your eyes? But there are just so many eye drops out there. How do you know which one to use? Do they pretty much work the same? What's in them? And which one worked the best? Today, I want to talk about a big category of eye drops that people use, the artificial tears. I'm Dr. Sunny. I'm an optometrist in Canada. Artificial tear, aka lubricating eye drops, are primarily used to lubricate the ocular surface. It is the first line of treatment for dry eye disease. It is also used to assist the recovery of epithelial cell damage in the case of an eye injury or severe dry eye. The surface of our eyes are covered with a very thin but very important layer of tear film. Our natural tear film contains oxygen, electrolytes, antimicrobials, and protein. It keeps our ocular surface smooth, provides nutrients to our cornea, and forms a stable layer that lets us see well optically. When our tear film is thin and unstable, it can lead to a variety of symptoms ranging from ocular discomfort such as red, burning, tired eyes, to decreased vision, to actual damage to the top layer of cells in our cornea. Artificial tears intend to mimic different components of our natural tear. Although our current technology cannot truly replicate our healthy tear film, it is a safe and effective supplement for people with dry eye disease. If you just type in artificial tears in Google Scholar, a lot of studies will come up. However, a big percentage of these studies have financial bias, meaning it is backed by the company that sells a particular brand of artificial tear. Also, the way a lot of these clinical trials are run are very different, making it hard to compare apple to apple to see if one brand of artificial tear is superior than another. Because of this, other studies have taken a different approach. They look at the ingredients in the artificial tears to see what functions they serve to alleviate dry eye symptoms and to protect the ocular surface. We will look at a few of them that plays key roles in the making of artificial tears. The first category is called Demulcents. Some studies also refer to them as viscosity-enhancing agents. The FDA defines Demulcents as an agent which is applied topically to the eye to protect and lubricate mucous membrane surfaces and to relieve dryness and irritation. It is listed under active ingredients in eye drops sold on the US and Canada market. One of the common demulcents that we see are carboxymethylcellulose, or CMC for short. It is found in Refresh and TheraTear line of products. Lower viscosity artificial tears like Refresh tears has a lower concentration of CMC. They are more free-floating and does not blur your vision as much, but stays in the eye for a shorter time. Higher viscosity eye drops like Refresh Tear Liquid Gel has a higher concentration of CMC. They stay in the eye for longer, provide greater relief of dry eye symptoms, but cause temporarily blurred vision, and it leaves kind of a debris on the eyelids and eyelashes. It is recommended to use low viscosity artificial tears during the day and higher viscosity gel drops or ointments at nighttime. Another two demulcents we commonly see used in combination are propylene glycol or PPG and polyethylene or PEG. These two demulcents are used in combination and are seen in Sustain, Blink, and Soothe line of products. Something unique about the Sustain eye drop is that all of their products also contain something called hydroxypropyl-GOR, or HP-GOR. What's cool about it is when HP-GOR comes in contact with the eye, the pH of the tear activates it, so it combines with the two other demulcents, PPG and PEG, and turns the eye drop from a liquid into a low viscosity gel that form a protective layer on the surface of the eye and allow any damaged corneal epitheliums to self-heal. Also, pH-GOR in Sustain acts to stabilize the tear film, letting the eye drop stay in your eyes for longer without it being too viscous or blur your vision. The second category is very interesting. Some studies call them biologically active excipients. These ingredients are listed as inactive ingredients on the US and Canadian market. Now, whether something is listed as active or inactive ingredients is more of a regulation thing. It does not mean that they are not helpful. In fact, these biologically active ingredients have some very unique properties that increase water retention, reduce inflammation, and promote wound healing. The ingredient pH score that we just mentioned that are in all sustained products technically belongs to this category and is listed as an inactive ingredient. Hyaluronic acid and trehalose are the two other common biologically active excipients that we see. Hyaluronic acid is naturally occurring in our body, and it is an excellent water-retaining agent. High molecular weight hyaluronic acid are shown to have anti-inflammatory properties and promote wound healing after corneal injury. Over-the-counter brands such as Hylo, Sustain Ultra Hydration, Sustain Complete all contain sodium hyaluronate. Trehalose is an osmoprotectant. It protects the corneal epithelial cells in hyperosmolarity environments. Hyperosmolarity of the tear film is commonly observed in dry eye patients. Think of it as when your eyes are dry, your tear can become overly concentrated because the water content in your tears evaporate too fast. High osmolarity put high stress on the corneal epithelial cells and can trigger cell death, aka apoptosis. Studies have shown that dehydrated cells can take up trehalose, and trehalose can restore cell volume and prevent protein denaturation. So basically, it prevents your corneal epithelium cells from shrivel up and die. There are actually quite a few brands of artificial tears that contain a good percentage of hyaluronic acid or trehalose or both of them combined. These products are technically over-the-counter in the sense that you don't really need a prescription to get it. But in the area where I live in, these products are mainly sold in eye care professionals' offices. So ask your doctor to see what dry eye products they carry in their office. Now, there are a few artificial tears on the market that looks opaque or milky in color. This is because they contain an oil agent. The oily agent mimics the outermost lipid layer of the tear film. This lipid layer is mostly produced by our meibomian glands that are on our eyelids. People with meibomian gland dysfunction have a much thinner and unstable lipid layer in their tear film. As a consequence, their tear evaporates a lot faster. The oily agents in these artificial tears aim to slow down the tear evaporation. These oily agents can be castor oil, flaxseed oil, or mineral oil. Common products that have these oily agents are Sustain Balance, Sustain Complete, Refresh Optive Advanced, and Refresh Optive Mega 3. The oily agents are also commonly seen in eye ointments. For example, Refresh Lacrylube contains about 40% of mineral oil. Finally, let's talk about this last category of ingredients, the preservatives. The most common packaging of any eye drops we see is this multi-dose eye drop bottle. But here's the thing. If you're going to open and close this bottle multiple times to use it, there better be some form of ingredients in here to prevent microbial growth. Here's a common list of preservatives found in artificial tears. I want to talk about benzochronium chloride, also known as BAK. BAK is very common and is also used as preservatives in many medicated eye drops, like glaucoma eye drops. It is an effective antimicrobial agent, but studies show that BAK can slow down corneal epithelium healing, increase the release of pro-inflammatory mediators, and exacerbate dry eye in the long run. This seems counterintuitive to the use of artificial tears. Many brands of multi-dose artificial tears also have their preservative-free counterparts. On the package, it will be labeled as preservative-free. The preservative-free package can come in these single-dose tubes or this multi-dose bottle. This type of specialized dispenser are designed to prevent microbial contamination. Here, I would let you compare between this is a regular multi-dose container with preservative in it, and this is a preservative-free multi-dose container. I like this multi-dose preservative-free bottle a lot better, mainly because it is less wasteful and easier to carry around. In my clinic, if patients exhibit even mild dry eye symptoms, I do advise them to switch to preservative-free artificial tears. Your eyes are already sensitive, might as well just to get rid of preservatives altogether. However, price-wise, these multi-dose eye drops are cheaper compared to their preservative-free counterparts. So, hopefully you guys get the idea that artificial tear actually has a lot of ingredients in it that soothes the ocular surface, increases water retention, reduces evaporation, and promotes healing. In summary, drops that have a higher viscosity provides longer-lasting relief of dry eye symptoms, but it does blur your vision and leave some debris on your lids and lashes. So it is best to use gel drops or eye ointments at nighttime, while using low-viscosity artificial tears during the day. If you have moderate to severe dry eye or know that you have meibomian gland dysfunction, consider using artificial tears that have oil agents in them, such as Sustain Complete or Refresh Optive Advanced, to further slow down tear evaporation. Multi-dose eye drop bottles will always come with preservatives. Choosing brands that has the soft preservative in them if you are using the artificial tears occasionally. Avoid using BAK preservative eye drops, especially if you're wearing contact lens. Preservative-free eye drops should be used for glaucoma patients who uses preserved glaucoma eye drops long-term. Patients who just had an eye surgery or patients with acute corneal damage should be using preservative-free artificial tears. Dry eye disease is a complicated and chronic condition. Artificial tears is only part of the treatment. You want to treat the underlying cause of the dry eye in addition to alleviating the symptoms. So talk to your optometrist to see what other treatment options are available. If you like eye care related content like this, please like and subscribe. I got a lot more to share. See you next time!